So a herniated disc is essentially a situation where the inner substance of a disc pushes out and pinches on the spinal nerves. Now, the discs are basically the cushion between the vertebral bones. And when we have a disc that is nicely hydrated, a young, healthy disc, it is able to resist a lot of forces and allows for essentially shock absorption between the bones. As we age, our discs lose some of that water content and they become a little more fragile. And what can happen is that some of the inner substance, that's more of the gel-like material, can push out and go into the spinal canal, which is where the spinal nerves are. And if that happens, that's what we refer to as a herniated disc, and that can pinch up against the spinal nerves and cause leg pain. Herniated discs can occur anywhere within the spine, although the most common presentations are really in the cervical spine and the lumbar spine. Usually patients with a herniated disc will present with severe leg pain. Sometimes it's also associated with numbness and tingling, and oftentimes it may be associated with muscle weakness. Part of the workup, of course, involves a physical exam, in which case we will determine whether there's any loss of strength, whether there are tension signs that suggest that a nerve root's being irritated, and then typically we'll also get x-rays to see if there's any abnormalities with the disc spaces, and ultimately with symptoms being present and severe, we'll typically get an MRI study, which is the definitive diagnostic study to show the herniation. Now, for the most part, 80 to 85% of patients with the herniated disc and sciatica pain will improve without surgery. So the statistics are in favor that you won't ultimately need to have a surgery. Surgery for a herniated disc is referred to as a microdiscectomy or a laminectomy discectomy. And basically what it involves is removing a small amount of bone and some of the interconnecting ligament structure in the back part of the spinal canal to allow access to where the nerves are passing. The nerves can then be moved off to the side, allowing us to access the disc space and remove the herniated material, freeing up space for the spinal nerves. This is a surgery that typically is done within an hour and a half. Oftentimes it can be an outpatient procedure. The recovery involves some activity modification, limiting repetitive twisting, bending, lifting, anything that loads the disc mechanically for a period of about 6 to 8 weeks, and gradually resuming normal activities.